Welcome back, everybody. It is time for Talking Kids with Dr. Caitlynn, and today we're going to be talking about flu numbers and also strep. Dr. Caitlynn Iddings, a Lexington pediatrician. Always great to have you with us.
And Kentucky is setting some marks that we're not very proud of because it is frightening out there what we're dealing with.
So we've known that the flu came early this year. We've kind of talked about it a couple times already, but it has been a very angry, virulent strain of flu, and it's actually, we've already met our record for pediatric flu deaths in Kentucky, and it's still really early in the season. Usually, you know, we have flu kind of October through February, and here we are just in December, and we've already hit our record of 6 pediatric flu deaths, and 3 of those were just in the past week. So it has been a really virulent strain, and really just to harp on the point that we've talked about before is like all of those kids were unvaccinated. And so the flu vaccine, even though it's not fun to go take your kid to get it, it is really preventative as far as preventing deaths and hospitalizations.
Even if it doesn't prevent your child from getting it, it can prevent the severity of it.
Absolutely. And I've seen that in clinic. You know, the ones who haven't had the shot, some of them are having 6, 7, 8 days of fever, feeling really bad. Some of them that have had the shot, they come in and I look at them and I'm like, well, you have the flu, but you don't really look that sick, you know?
Which is good.
Which is great.
You want to see that.
That's what we want. And like I said, really the big thing is to prevent those young people or those people who are have comorbidities that we know they're higher risk for having severe complications and ending up in the hospital from getting really sick with it. So.
And a kid that's vaccinated also gives a parent a peace of mind as they're watching the symptoms go into the body and activate, because if you've got that booster, you got that backup, because that's one of the things we talked about is when do I call the doc, when do I do hospitalization, when do I take them in? If you're vaccinated, you know that you can rest easy a little bit anyway.
It really does help a lot as far as preventing the severity of the disease. So one other thing that we've been seeing a lot, which the health department just recently released a little memo on, is there's been this really invasive group A strep. So group A strep is what causes strep throat in kids. And typically it is just isolated to the throat, but what they've been seeing is it's been getting more what we call systemic, where it's actually getting into your system. It's ramping up your immune system. It's causing things like toxic shock syndrome that we can see from strep, really bad, you know, rashes that are peeling and kids are being hospitalized for them. Strep is also known for getting into the heart and causing what we call rheumatic fever, rheumatic heart disease, can get to the kidneys and kill your kidneys. And so this was first reported in Great Britain a couple of weeks ago, but we've been seeing this trend even in the United States over the past kind of couple of weeks and it's been a lot of kids who are co-infected with other viruses. So they think that there is some sort of link with like they have flu or they have RSV or they have some other virus, and then they get strep on top of that, and it's sort of the immune system is already amped up and it just kind of explodes and gets 10 times worse. So it's still been relatively rare, but they have been seeing, you know, some hospitals around the country, they said like a 4-fold increase in kids who have been admitted for this invasive group A strep disease. So.
Oh, I mean, and the biggest thing we can talk about this morning is prevention besides that vaccine. What other tips might you have for parents out there watching, hoping their child doesn't get sick with anything this season?
So definitely get your vaccine, and hand hygiene is still number one. Making sure you wash your hands frequently. You know, I tell my kids all the time, stop touching your face, you know, so and teachers, I'm sure you harp on this, please don't touch your face, stop picking your nose, stop putting your pencil in your mouth, because, you know, that's how most strep is passed, is by, you know, you put your hand in your mouth, you touch your pencil, your friend touches their your pencil to share it, or they touch your paper and then they touch their face, and so it's passed that way more than, you know, coughing, because strep usually is more by contact. So making sure you're doing good hand hygiene, not touching your face, not using utensils that other people are using, are kind of the number one things to prevent.
And if kids are symptomatic, a threshold, I guess we're looking for, if you have a thermometer, if the fever gets to a certain extent or a certain level, then you've got to call, I would assume, right?
Yeah, and so usually kids will complain of pretty significant sore throat, but other symptoms could be vomiting, upset stomach, high fevers. Like I said, this rash is sort of this red sandpapery feeling rash that tends to be kind of more on the upper body, in the armpits, sometimes in the groin area. So if you see like, oh, my kid has a fever and they don't have a lot of cough and congestion and their throat hurts, you definitely should bring them in to get checked, because it is very treatable.
All right, Doc, great to see you. Thank you so much. 6:56. Stay with us. Final look at your forecast coming up next.